Hi, my name is Hidri Mahari, and this is my evidence-based practice project on the effectiveness of bed alarms for fall prevention. Falls have always been a major concern for patients in the hospital causing severe injury or death. According to the Agency for Healthcare Research and Quality, between 700,000 to a million people in the United States fall in the hospital, resulting in many secondary issues such as fractures, lacerations, and internal bleeding. The purpose of this evidence-based practice project is to determine the effectiveness of bed alarms in preventing falls in older adults in the hospital and or long-term care facilities. Organizations that would benefit from this evidence-based project would be all hospitals and long-term care facilities, especially hospital patients ages 65 and older. Doing this project, the search methods that I used were electronic databases, which included PubMed, peer review articles between 2013 and 2020, and I did internet searches for Joint Commission journals and statistics from the Agency for Healthcare Research and Quality, which had really good data on preventing falls. So the first study I looked at was an effect of intervention to increase bed alarm use to prevent falls in hospitalized patients. So the purpose of this study was to investigate whether the intervention of bed alarms used in the hospital will decrease fall accidents. This study consisted of 27,672 inpatients who were hospitalized in general med-surg and specialty units. This was a pair-matched cluster randomized trial which lasted over the period of 18 months. Independent variable in the study being the use of bed alarms, and dependent variable or the intervention group in this was the education, training, and technical support to promote use of standard bed alarm systems measured by pre-post difference in change in falls per 1,000 patient fall days. The study revealed that the increased use of bed alarms had no significant effect in relation to preventing falls. The article suggests that bed alarms can be useful in collaboration with the fall prevention plan, but on its own does not have a great deal in preventing fall incidents. As far as implications in this study, they noted that bed alarms may be a useful component, as I mentioned, component of well-defined hospital fall prevention programs, but are unlikely to be simple and effective for fall prevention solutions. The second study I looked at was REFINE, Reducing Falls in Inpatient Elderly Using Bed and Bedside Chair Pressure Sensors Linked to Radio Pagers in Acute Hospital Care, a randomized controlled trial. And the hypothesis in this study, they tested to see the use of bed alarms when in use with a paging device to alert staff when patients are getting up from the bed or chair can decrease the number of falls in older patients who are hospitalized in acute care settings. This was a pragmatic paramount individual randomized control trial. The sample size included 1,839 patients of 5 different acute care wards at Nottingham University Hospital. Independent variable in this study being the pressure sensor system, and the dependent variable being standard care. This was measured by falls per 1,000 bed days. The results of this study has shown that bed and chair pressure sensors cannot work as a single intervention to reduce falls. They also noted that these bed alarms are not cost-effective for hospitals. So further studies would be to determine whether falls can be successfully used to prevent falls, as well as cost-effective for the hospitals, finding a better way. And study 3, the effectiveness of a wireless modular bed absence sensor device for fall prevention among older inpatients. The purpose of this study was to determine the effectiveness of wireless modular bed absence sensors devices to prevent falls in older patients ages 65 and older. The sample size consisted of only 47 patients admitted to the acute geriatric ward during a 2-month period from January to March 2014. Independent variable in the study being the bed alarm, and dependent variable being the number of falls measured by true alarms and false alarms. The findings from this study showed that bed alarm systems was effective in alerting nurses and staff of patient bed absence. Nurses who were interviewed in the study felt that the device was effective in preventing falls. The article suggests that further studies should now be made using ambulatory patients in institutionalized settings. Also, a larger cluster randomized study to measure actual fall outcome associated with the use of device is now also indicated. Nursing implications. The use of bed alarms should be used with other methods to prevent falls, such as making sure patients can be identified, fall risk patients can be identified. So that means using the yellow bracelets, yellow socks, yellow gown. I know it's different for every hospital. Making sure that nurses are hourly rounding as well as other patient care staff. So whether that be the techs, in this case, just making sure everyone's rounding, scheduled toileting, use of non-skid socks, and also removing rugs, trash from the floor, anything that could cause a patient to trip and fall, and develop an individualized care plan for each patient who is at risk for falls. So every patient is different, making sure that we come up with a specific plan for this patient so that we are doing our best to prevent falls. And so in conclusion, bed alarms cannot be used on their own to prevent fall, as data has shown that there's no significant decrease in falls with their use. With collaboration of other methods used to prevent falls, bed alarms can be helpful in alerting nurses and hospital staff before a possible fall. And further studies should be done to determine the effectiveness of bed alarms when other methods of fall prevention are also put into action. Looking at all the evidence from these articles, I stand with the decision that bed alarms can work and should be implemented into hospital policies if they are used in conjunction with other fall prevention methods such as those mentioned before. And that is it. I hope you guys enjoyed. Thank you so much. Bye-bye.